Hey everyone, for any of you who don't know who I am, my name is Jill Robbins, and if you're coming into our office to have some Morpheus8 treatments done, I'll be the one that does your treatments. So this little video is to help you prepare for your treatments. So it will serve as a reminder of what we talked about in your consult, or if you've never met me, this is going to be good information for you to know leading up to your treatment so you know what to expect. First of all, I will be sending in prescriptions for you. The first prescription will be for Valtrex. That is to help prevent cold sores. Cold sores can happen to skin after trauma to the skin, and so I want to do everything that I can to prevent that from happening. So that will be sent to the pharmacy of your choice, and you'll want to make sure that you have that picked up before your appointment because you will need to take 2 of those the morning of your treatment and then 2 that night. Other prescriptions that will likely be sent to the pharmacy is for pain control. So you should have been given the option of doing either oral sedation or Pronox, which is laughing gas. If we're going to do oral sedation, which is what I actually recommend, I will be sending those prescriptions to your pharmacy along with the Valtrex. Those 2 prescriptions would be typically hydrocodone and Ativan, and you would need to bring those with you to your appointment, and I'll give them to you when you're here in my chair at the appropriate timing. So number 1, pick up those prescriptions, have them ready to go before the day of your treatment. Alright, so getting dressed, getting ready to come into your appointment. You will want to make sure that you wear something that fastens in the front, so it either zips or buttons, something that you won't have to pull over your head after the treatment, because you will have ointments and PRP on your face and it'll be hard to just pull that clothing over your head. So it'll be more comfortable if you wear something that fastens in the front and that keeps you warm on your drive home, because your face will be really warm and you'll likely want to have the air conditioning blowing on your face, but then the rest of you will be freezing. So make sure you wear something warm that fastens up in the front. Also, when you're getting ready to come to your appointment, make sure you bring an iPad, a book, something to keep you busy, because you will be sitting here for about an hour with topical numbing on your face, and so you'll just want something to keep you busy. One more thing for day of procedure, I do ask that you do not take any kind of antihistamine like Zyrtec, Claritin, Allegra, anything like that, or any anti-inflammatories like ibuprofen, Motrin, Aleve. Those types of things will calm the skin down. I'm intentionally causing an inflammatory response in your skin, and I want your body to recognize that. So I do ask that you don't take any of those types of things the day of your treatment, as well as 2 days after your treatment. Also, when you come in for your treatment, please come in with no makeup on your face, just a nice, fresh, clean face, no makeup, no moisturizers, nothing on your skin. That'll just make the process a lot quicker and easier. So I have a lot of people ask me, how long can I expect to be here? Especially if you're taking the oral sedation medications, you'll have to have a driver. So whoever brings you to your appointment, they don't have to stay here the whole time. They can go to the mall, go for a walk, whatever they like to do, but they will need to be here to pick you up and drive you home. And so you can expect to be here for anywhere from an hour and a half to even 3 hours. You will always sit and numb for 1 full hour, and then the actual treatment time will depend on what we're treating. If we're just doing lower face, jawline area, you can expect about 30 minutes of treatment time. But if we're doing full face and neck or large body areas, you can expect to be here for another hour to 2 hours. So that time of how long you're going to be here is going to vary on what we're treating. What to expect afterwards. You can expect afterwards that you will be really, really red and really, really hot for about an hour. After that hour, then that intense heat and intense redness dissipates to a mild tenderness and mild pink and kind of splotchy. But do expect to be bruised, possibly swollen, especially under the eyes and then in this area, for about 3 to 5 days. So you want to make sure that you plan this accordingly so that you've got plenty of time to heal. You may not need that much time, but I would rather you prepare for that much time and not need it. After that 3 to 5 days, then you don't see much of any signs of any kind of treatment. You can even put makeup on your skin after just about 48 hours. If you have any questions, don't hesitate to reach out to us either on Instagram or email, phone call, whatever is the easiest way for you to get in touch with our office.